Hey guys, this is my discussion board response for week number 4 regarding depression in children and adolescents. So first I just want to talk about the signs and symptoms of depression in children and adolescents. There can be a various array of symptoms and it's really individualized, but I'll just go over some common ones for this population. So sadness and a despondent mood that is out of proportion with the life events that's occurring in the child or adolescent's life. They can lack energy, motivation. They may want to just lay in bed all day and all night, or they may have trouble sleeping. They may be suffering anxiety as well, which can prevent them from sleeping. Abnormal eating habits, feelings of despair, guilt, hopelessness, a lack of self-esteem, lack of self-worth, or just overall misery. In adolescence, a common symptom can be an obsession with death or expression of the desire to commit suicide. Obviously, that's something that needs to be taken seriously and can be very dangerous. These patients may also experience delusions or hallucinations if their depression becomes too severe. They also may neglect responsibilities such as school or even extracurricular activities that they once really found joy in, such as soccer, baseball. They may no longer have the drive and motivation to do these things. They may start skipping school. So those are all signs. A lack of interest in their personal appearance. They may just lack the motivation to really care about their self-hygiene. They may really not even have the energy to shower or get ready. That's how severe depression can be. They just, even that task is a daunting task for some of these patients. And just another thing is the avoidance of psychosocial and social interactions. They may kind of recluse themselves, be more isolated than they were before, not, try to connect with friends and family as they once did. So again, signs and symptoms are individual for patients of depression who suffer from depression, but these are just a few signs and symptoms, but it's just really the inability to function at their normal level when they were healthy individuals. So the pathophysiology of depression is not completely understood. Depression is one of the oldest and most frequently diagnosed mental health disorders, so it's been around for a long time. Many studies have been done, and evidence points to a lot of different causes, but it really can come from many different factors. So we'll just kind of discuss a few of the main ones. The first one I want to talk about focuses on the levels and functions of neurotransmitters in the limbic system of the brain. The limbic system is the part of the brain that controls our emotional status. So this evidence suggests that neurotransmitters called norepinephrine, serotonin, and dopamine and the limbic system, the levels of these neurotransmitters can contribute to depression. It is not completely understood whether the depression causes the low levels of neurotransmitters or the low levels of neurotransmitters are causing the depression. Another contributing factor may be the endocrine system. A lot of evidence shows that about half of people who suffer from depression have high levels of serum cortisol in their blood, and cortisol is a hormone that our bodies release in stressful situations to mobilize the body, and high cortisol levels are associated with low serotonin levels. So we all know that when we're stressed and things get a little crazy, we definitely don't feel happy, and that's because the cortisol levels are depleting our serotonin levels. So that can be a contributing factor. Another cause can be hypothyroidism. That has been linked to depression. Hypothyroidism kind of slows the body down. The patient can feel tired, fatigued, lack motivation, and that can lead to depression. Typically, if this is the only cause when the patient is diagnosed with hypothyroidism and properly treated with medication, the depression should dissipate. Okay, so other factors that contribute to depression are genetic and environmental factors. Genetics plays a large role. Many studies have been done studying the contributing efforts of genetics in depression. Evidence shows that if you have a primary relative that has depression, you're at a much higher chance of getting it yourself. A lot of studies have been done in families, between twins, adoption studies, and they pretty much have proven this. So the studies have shown that the influence of genetics is about 30 to 40%, and then the remaining 60 to 70% could be environmental factors. So some environmental factors that can occur in childhood, usually occurs in childhood, and can affect the child, adolescence, and even into adulthood, can really be anything traumatic that the child has gone through. Sexual abuse is a big one. Low social support, a parent abandoning them, losing a parent, anything that they perceive as being traumatic, even going through a really bad divorce, or anything like that, can contribute to a child or an adolescent's depression. So that kind of wraps up some of the causes or the pathophysiology of depression in this population. Now I want to talk about some of the common pharmacological medications that are prescribed for children and adolescents. Antidepressants are obviously what's used. There are different classes of them, but the goal is to use antidepressants to enhance, elevate, and stabilize the mood in these patients. They act by trying to restore the neurotransmitter balance in specific regions of the brain. Different medications focus on different neurotransmitters at different portions of the brain and kind of work in different ways. But the three neurotransmitters that they do work on is, again, norepinephrine, serotonin, and sometimes dopamine. So the main mechanism of antidepressants really focuses on blocking the enzymatic breakdown of norepinephrine and then slowing the reuptake of serotonin into the neurons to try to maximize the amount or the level of these neurotransmitters in the brain to help elevate the mood. The most common antidepressant class that's used for this population is tricyclic antidepressants. These work by blocking the reuptake transport of neurotransmitters, specifically norepinephrine and serotonin. So the result is more neurotransmitters being available between the synaptic space, which really causes a more intensified action. So there are more of these neurotransmitters there, helping to elevate the mood and stabilize the mood. Tricyclic antidepressants have been around for greater than 50 years. They are very effective and very inexpensive. So, they are typically used as a first-line treatment. Another class that is commonly used is SSRIs, which stands for selective serotonin reuptake inhibitors. These are not as old as tricyclics, but they are very effective and used frequently. So these drugs focus specifically on serotonin. What they do is block the reuptake of the neurotransmitter serotonin at the neuronal presynaptic membrane. So what this does is increases serotonin levels available at the postsynaptic receptor sites, which hopefully will enhance the mood, enhance the actions of serotonin, help elevate and stabilize the patient's mood. So that's the goal, is always to increase the level of neurotransmitters available in the brain. These are the two main classes that are used to treat this population, and we would discuss the pathophysiology as well and the signs and symptoms in children and adolescents. Thank you guys for listening to my blog, and I look forward to hearing your responses. Thank you.